At the age of 5, my life would forever be changed when the doctors told my parents and I, when we arrived to the hospital, that if I had not made it that day, I would have not made it through the night. I was 5 years old and a kindergartner, and I loved school. I was ecstatic, healthy, but all of a sudden, that changed. I recall being on my first kindergarten field trip, and as exciting as that was, all of a sudden, I was extremely parched, and my mom was on the field trip, and she looked at me, and I told her I needed water immediately. My lunchbox was at the bottom of the bus, but I needed it immediately. As soon as she found me a water bottle, and as soon as I pressed it to my lips, I guzzled the whole thing down. Another parent that was on the field trip, she looked at my mom and said, "Gosh, how long has this been happening for?" She said, "Gosh, only a couple of weeks." And she said to my mother, "This is a sign of type 1 diabetes." And my mom said, that can't be true, that can't be it. We don't even have family history. And just a couple of days later, I was at a friend's house, and the same thing happened again. But this time, they gave me a juice box. And just within minutes of having that juice box, I was throwing up profusely. My mom knew something was wrong. She took me to the pediatrician, and as soon as I sat on that scale, I weighed 35 pounds at 5 years old. They started running vitals on me and told me that they were going to call us back if anything crazy showed up. And indeed they did. They saw that my blood sugar was extremely high, and they told us we had to get to the hospital immediately. My parents quickly made arrangements for my 2 other siblings, and we drove a couple hours down to Indianapolis, Indiana, where we were living at the time. And on the way there, they called our family and said, "If you're not here soon, we're going to send an ambulance after her." As soon as I got there, just being 5 years old, I was crying, upset. They were holding me down as they were putting shots, taking blood draws out of me. And as a 5-year-old girl, I just wondered, what did I do to deserve this? What possibly could go wrong for me to hate shots? Everyone hates shots at a young age. Well, my worst fear just had come out. I went from being a carefree child at the age of 5 to now having a disease wage a war on every organ in my body. I went from having to just be able to eat whenever I wanted to giving shots, testing my blood sugar every 2 hours. And that week we spent in the hospital, my parents practiced giving each other saline shots just to learn how they were going to take care of myself. Now, what even is type 1 diabetes? So type 1 diabetes is an autoimmune disease where your body attacks your pancreas, killing all insulin-producing cells. And insulin is a hormone that allows for sugar to enter the cells and go through the process of producing energy for the body. At the time, I was going through this process where no beta cells were left and I had no insulin in my body. So without insulin and when I was consuming carbs, I would get extremely sick. And how does one develop type 1 diabetes? As I had mentioned earlier, I have had no family history of the disease, and in fact, only 10% of people living with type 1 diabetes have a family history of the disease. Now, if you have the genetic marker specifically located on chromosome 6 and then interact with a triggering environmental factor, such as you have another autoimmune disease, you live in a northern climate, you have a viral infection, you drink cow's milk at a young age, you can, in fact, have a higher likelihood of developing type 1 diabetes. And in fact, I did have the rotavirus at a young age. Now, that week we spent in the hospital, I was trying to look for the good in everything, and so were my parents, and they told me that they were going to take me to the Children's Hospital in Indianapolis, Indiana, and that's what I was looking forward to. And the first time we were there, that was going to be the first time I had to test my blood sugar in public. The 2-hour alarm went off, and I looked at my mom and said, "It's time, and we have to go to the bathroom because I'm not testing my blood sugar in public." And she looked at me and she said, "Emmabella, there's nothing to be ashamed of. You have had something awful happen to you, but it's not your fault. It's something, we can make, it's not your weakness." And that really set the tone moving forward and how I was going to live with this disease and not hide it and show people, as a young girl, I can do anything and everything despite having this autoimmune disease. And adjusting back to school, wasn't easy, but every meal now, I had to have an insulin shot. It was one before breakfast, one before lunch, and one before dinner. And my mom came to school every single day when I was in kindergarten, giving me an insulin shot right before lunch. I remember her sitting at the kitchen table, counting out exactly 50 pieces of goldfish to make sure that I got 15 carbs and not anything more or anything less. And that was our reality. Additionally, as I had mentioned, every 2 hours we had to check my blood sugar. And this resulted in also all times of the night. Believe it or not, even when my blood sugar was low and I was sleeping, my mom or dad was able to stick a straw of juice box in my mouth, and I sucked it down while I was asleep. So, we did make adjustments and adjusting to this disease, but it was almost like I was an infant again. It was almost like they were waking up every 2 hours to make sure I was just alive. Now, as I grew older and as I moved here to Florida and got to my first year of being back being a fourth grader, a lot of people didn't really understand type 1 because the school I came from, everybody knew what type 1 diabetes was. And so I really wanted to educate other people, so I started doing educational presentations. And when I entered the 6th grade, right before school started, I sent an email to my principal, and I also sent it to my guidance counselor saying, I really want to do an educational presentation at my middle school. And then the first day of middle school can be hard for everybody, but she pulled me aside the first period and said, Emmabella, do you really want to do this educational presentation? Do you really want to be known as the girl with diabetes? And that shook me and took every little piece of what I had been fighting for out. How could I move forward with someone or something that maybe every student I was going to school with would think there's a diabetes girl, and that made me question everything. But just a year later, I applied to Children's Congress, and I went to Capitol Hill to advocate to my legislators about the importance of type 1 diabetes funding, research, and education. And we advocated for the Special Diabetes Program, which funds $150 million to diabetes research every year. And when I found out that exact policy I was there advocating for, and along with others, students and kids, I was ecstatic, and I realized this was my passion, and government and policy related to diabetes, this is what I needed to work on. And then I went back to that middle school, and I did do that educational presentation. Thank you. Now, every year, along with my mom and other diabetes advocates, we go to Capitol Hill and advocate for important issues that threaten the type 1 community and also type 2 community. And we work to gain their support in advocating for these measures. So why is diabetes advocacy so important? So shortly after being diabetic for 1 year, I switched to an insulin pump. And this was the first insulin pump I was on. It was incredible. Instead of having to do shots every single day, I only had to change my insulin pump every 3 days. So that was one shot. I still had to prick my fingers and still had the scabs, of course, but this was a life changer. Now today, I wear another insulin pump, which I'm wearing right here, and it's incredible. It just has a tube. It gives insulin every day or every minute. I'm up here, and I've gotten insulin while I've been talking to you. And also, it connects to my constant glucose monitor, which I wear. This is my constant glucose monitor I wear on my arm, and you can't see it because I have a long sleeve on, but this monitors my blood sugar 24/7 using a little microchip under the skin, and it's been incredible. And I was able to try the first constant glucose monitor back in 2008, and it's improved so much since then. And that's all because of research dollars going to improve the lives. We, as type 1 diabetics, have a shorter lifespan, and these technologies will make those lifespans much longer. And it's just a relief of a burden that diabetes places on you. And additionally, this constant glucose monitor actually connects to my iPhone, and I can share this to anyone I'd like, my family members, my friends, and it relieves some of that burden that I'm not always fighting this disease by myself. Additionally, shortly after I was diagnosed, we got involved with the Juvenile Diabetes Research Foundation and started fundraising. We made a walk team, Emmabella's Believers, unicorn on the front. Me and my passion, we were able to just organize and get people out there to support us in our mission to try to find a cure for type 1 diabetes. And that happened the first year I was diagnosed. We got over 120 people out there and raised over $10,000 just in that first couple of months I was living with this disease. And additionally, they invited me to go, and my family, to go to Congressman Donnelly's office and meet with him and share our story. So my question to you, are research dollars the only issue when it comes to advocating for diabetes? I want to welcome you to your neighborhood pharmacy in the United States where Big Pharma places a price on my life, on your life, and also on the vial that keeps us alive. This is insulin, and I need it to stay alive, and every other person with type 1 diabetes needs it as well. Currently, in the US, this is manufactured for $2 to $6, and it is upcharged to $250 to $300 a vial. This has led to people rationing the drug, choosing between their food, their rent, their electricity, water bills for this drug that keeps them alive. 1 in 4 people, according to Yale Diabetes Center, rations this drug currently in the United States. Our healthcare system in the United States is broken. And due to free market pricing, the United States list drug prices have become the highest amongst all developed countries. On average, the US pays 50% more in healthcare than any developed and regulated markets across the world. So insulin hasn't always been expensive. Why is it expensive now? These companies that manufacture the drug use patent evergreening. There's a lack of generic insulins like other pharmaceutical drugs. You could just probably get a cheaper one. That doesn't exist with insulin. There's pharmaceutical benefit managers that exist and wholesalers, which price the drug to you, and they price it higher so that they get a check in their pocket. There's also a thing called price fixing, where individuals price the drug based on what the other corporations are pricing it at. And lobbying in the big 3, which I will speak about in just a second. Only 3 companies supply insulin to patients in the United States, and these companies make up 90% of the global insulin market, resulting in they can do whatever they want. Why should you care? Why should normal, people that don't maybe necessarily rely on prescription drugs to stay alive worry or care about this? Well, according to Georgetown's Health Policy Institute, 66% of US adults use prescription drugs. So that could be you, that could be your spouse, that could be your child that relies on a drug to stay alive that is currently being price gouged in the United States. So what do we do? What do we do about it when these corporations are taking advantage? At the age of 16, I was fortunate enough to work with the Senate and the House to work on my own bill that I was really passionate about, working to bridge the gap between patients and also physicians who may not realize the symptoms of type 1 diabetes, because as I mentioned, they're very subtle and very, very much go misdiagnosed. So I was able to work on that, and that was filed in the state and the House, or the state and the Senate, and that was amazing. It made me realize, I do have the power to speak up and share my opinions about policy. But then additionally, my first semester here at Florida State University, I was able to work with Senator Janet Cruz, who's been the sponsor of the insulin bill for the last 3 sessions. And she and her office asked me to look at this bill and give my input on how I felt about it. But there's still a reason we are working today, unfortunately. Pharmaceuticals lobbying spent $353.94 million lobbying our government last year. They use these expensive drugs, these expensive therapies to fund their own agenda and interest back into the price and to guard their price. Now, when we first started this first session on the first insulin copay cap here in Florida, we were really excited because the Senate passed it unanimously within the first committee, and then we turned to the House side. And the House side, the first committee it was supposed to go through was a chairman who's actually an emergency room doctor. And we were excited. How could an emergency room doctor not understand the necessity of insulin being affordable? Because just hours without insulin, you can end up in a fatal situation. And he refused to hear the bill. He refused to hear the bill. An emergency room doctor refused to hear the bill. And this confused me, it confused the rest of the advocates, so I did some research. He received $28,000 from pharmaceutical and health products, $27,000 from lawyers and lobbyists, and $24,000 from insurance companies. And overall, $127,000 from just health in general. If this doesn't go to show you that our healthcare system is broken, then I don't know what will. We need change. 100 years ago, the co-discoverer of insulin, Frederick Banting, said that insulin does not belong to me, it belongs to the world. And so he went and sold insulin, the patent of insulin, to the University of Toronto for $1. And the same wish of his does not exist today. Now I want to leave you with, how can you guys all help? Whether you have a connection with type 1 diabetes or not, share, spread the word, write to your legislators. Ask them why they aren't capping the price of insulin. Why aren't they regulating this? Or in turn, run for office. Sponsor your own legislation. And this goes for any issue that you're passionate about. Because truly, at the end of the day, patients are going to win this fight because insulin deserves to be for all, and insulin is a human right as well as healthcare. So thank you.